But finally, we're going to turn over to the IRC. We're really delighted to be joined by Cherie Bennett and Christoph Kurtz from the IRC in New York City. So from Bogota to New York, we're moving. Cherie is a technical advisor within the Research, Evaluation, and Learning Unit at the IRC, which is part of the Evidence to Action team. This team focuses on increasing the use of evidence in programmatic and policy decisions within the IRC, as well as the broader humanitarian sector. And Christoph is the Deputy Director with IRC's Research, Evaluation, and Learning Unit, which oversees the Evidence to Action initiative. And this initiative is comprised of a number of activities, but we're primarily interested today in hearing about the Outcomes and Evidence Framework, which has been developed by the IRC as part of their Evidence to Action initiative. The Outcomes and Evidence Framework is a set of tools to guide IRC staff, as well as other humanitarian practitioners, in designing and delivering high-impact response programs. I know that Cherie and Christoph will mention this, but I just want to highlight that they're going to be showing you the beta version today of the OEF, and the IRC is really keen to get your feedback on this tool so that they can make revisions ahead of the official launch of this tool in September. So thank you so much, Cherie and Christoph, for joining us today, and over to you to introduce us to this new tool.
Thank you so much, Alice, and thank you for organizing this session. Thanks to everyone for joining us. We look forward to sharing the beta version of the interactive OEF with you today, and we also look forward to all the subsequent discussions. So the IRC developed the Outcomes and Evidence Framework in order to achieve greater impact in the lives of those we serve. We want to do so by focusing our efforts on 5 outcome areas, and they are health, economic well-being, safety, education, and power. We believe that the best way to improve our effectiveness is to do work that is driven by outcomes based on evidence and grounded in context. And for us, that means 3 things. First, it means defining and measuring success by the change in people's lives. And in these 5 outcome areas in particular, it also means defining and designing the best possible interventions. And for us, that means using evidence, contextual knowledge, and information and feedback from our clients in the program design process. And finally, it means systematically measuring progress in outcomes so that we can learn and continuously improve. So for these reasons, we've developed the Outcomes and Evidence Framework. And the framework provides the practical resources needed to make incremental but significant steps towards becoming an outcomes-driven and evidence-based organization. So the Outcomes and Evidence Framework, or OEF as we call it, contains definitions of the outcomes areas, a list of all the outcomes within each of the outcome areas, theories of change and accompanying narratives about how to achieve outcomes, core indicators and guidance notes that help us to measure progress towards outcomes, and finally, evidence summaries and maps that help us to choose among interventions. We believe that by combining all of these tools in one easy-to-use electronic application, we are making it easier for practitioners inside IRC and outside, especially those in the field, to both access and use evidence at the point of program design. So we'll be exploring the beta version of the interactive OEF together today. All right, so here we have our landing page, our home page. There are a number of ways to enter the interactive OEF, but I will just focus on giving you an overview of what's here on the landing page first. So first you'll see an overview of the interactive OEF, and then below you'll see some scrollable links that tell you even more information about what the OEF is, what the outcome areas that I just mentioned and the outcomes are. The theories of changes, we've defined them and described them here in the IOEF, and the research evidence that we've used to support the theories of change. The research evidence we've synthesized and presented here in the IOEF as well. And of course, for those outside IRC, we have a little blurb on exactly what the IRC does. So just looking at this top left-hand corner, you'll see a button that says outcome areas. That's one way that we can enter the IOEF. And of course, this main button here does the same. So let's go ahead and press that. All right, good. So we've designed this tool for use by program staff, particularly practitioners in the field, and we've intended for this to be used particularly during proposal development and program design processes. So let's say that a field coordinator is interested in designing a program in education. So upon entering the Outcomes and Evidence Framework, we'll notice these broad outcome areas: economic well-being, power, and education. So the outcome area, again, is synonymous with sector, right? But let's say that in particular, this field coordinator is interested in this particular outcome, which is achieving an outcome for school-age children. So school-age children have literacy, numeracy, and social emotional skills according to their development potential. So if I click on that, what happens here is I'll see an overview of the layout of the IOEF. It basically just gives you information about how to read the different panes. So we just click close. We'll see the actual IOEF here. So here on top is the outcome that we just mentioned, right? So school-age children, or children 6 to 14 years old, have literacy, numeracy, and social emotional skills. It's highlighted here at the top. And below it is what we are calling our theory of change map. All right. And on the left is a list of all the sub-outcomes that are necessary for achieving the higher level outcome. So here on this left panel, we also will include a link to core indicators, which will provide guidance on how to measure progress towards achieving each of these sub-outcomes. We're currently in the process of uploading those and intend to have them fully populated in version 2 of the IOEF. So hovering over a sub-outcome here on the right panel highlights the pathway that is necessary for achieving that given sub-outcome. All right. Now, clicking on this download button up here in the top right-hand corner brings us to a hard or print copy version of the theory of change itself, the theory of change map. Right? This version, of course, we're encouraging everyone to use as well, and we typically read our theories of change from bottom to top, so from the lowest level sub-outcome to the ultimate outcome we want to achieve. We've indicated the different levels here, right? And we've also indicated linkages to other outcome areas. As we know, achieving any given outcome requires efforts from other sectors. And so in an effort to break down the sort of siloed ways in which we as practitioners often operate, we have made sure to highlight these linkages. Right? Now, that functionality is not currently present in this beta version of the IOEF, so the linkages are not currently here, but this is something that's important and that we're working on rectifying for version 2. All right, So let's say that I'm interested in a particular sub-outcome, right? Teachers deliver quality instruction in reading, math, and SEL to all girls and boys. Clicking on that sub-outcome brings up a new panel on the left. Again, in very bold letters here, it tells you what the sub-outcome is. And below that, you'll see what we're calling evidence cards. So these evidence cards have information about interventions and evidence that describes the relationship between the interventions and a given sub-outcome. So it should be noted that the evidence in the IOEF, or interactive OEF, is based on syntheses of systematic reviews. So the conclusions presented on each evidence card is based on the conclusions drawn from the excellent systematic reviews conducted and made available through evidence repositories such as 3IE's, Campbell's, Cochrane's, and so on. You'll also notice that here over on the left, each evidence card is color-coded. Right? We scroll down a little more. These are color-coded. So let's click on the help function to see what these color codes mean. So here we have 6 color codes that help us categorize the general conclusions that are drawn from these synthesized systematic reviews. So here we see that the full green box means positive impact in low-income context or fragile settings. The sort of hollowed out green box is positive impact, but in more stable contexts. The yellow boxes indicate limited evidence of positive impact or uncertain impact. Red indicates negative or no impact, and gray is no relevant evidence. So again, we should point out both for the gray tags and for tags that we might find here, such as no data in the theory of change here, it really means that there isn't, it doesn't mean that there isn't any evidence at all in the world around this sub-outcome. What it means is there is no relevant evidence drawn from systematic reviews that are currently available and in this IOEF. All right? So again, our evidence base is limited because we made a deliberate decision to start with systematic reviews given the high quality of these reviews, but we are working on efforts to extend that evidence base. All right? All right, so let's say that I'm interested in a particular intervention. For example, interventions to increase marginalized groups' access to education. So if I click on the evidence card, some more information is provided to me. First, I see a general summary of course, what the color code means, but what the general conclusion is from all the systematic reviews available that is relevant to this intervention and to the sub-outcome. And in this case, it's green because there's systematic review evidence that's extracted from studies conducted in low-income context or fragile states. Further down, I can find more information about the study itself. So the special focus line tells me if there's something very unique about the systematic reviews related to this intervention. And in this case, 2 unique features are present. One is that the review includes gender analysis, and the second is that it also includes a cost analysis. Another bit of useful information is about the population. So exactly whom was studied, who was studied and who was involved. The studies focused on girls of school age in low and middle income countries. Some systematic reviews include an effect size, and where that's available, we include it here as well. In this case, there was no effect size calculated. We can learn a little bit more about the study by clicking on this View Citation link. That tells us the title of the study, the author or authors, the location of the study, and again, these are syntheses of systematic reviews, so they're often from multiple countries. And then there's a link here that will take us to the full text of the study. Unfortunately, at this time, we're only able to offer the full text to IRC staff, but we are working on increasing or obtaining permissions to increase access to the wider public. Okay. So that's the main information available on an evidence card, and this is the general overview of the interactive OEF. It is still in beta version, and we look forward to further engagement with you here on the call and later on to learn how to improve as we go along. So at this point, I will hand back over to Christoph.
Okay, thank you, Cherie. All right, so now you've seen, again, as a reminder, so we combined these various tools that we had developed independently, the definition of the outcome areas, a definition of 26 more specific outcomes that came with theories of change and narratives, core indicators and guidance notes for each of the 26 outcomes, and then evidence summaries and maps for each of the 5 broader outcome areas. I'll tell you a little bit briefly about the process of how we got there. So this was a significant organizational undertaking. It was a 15-month-long process that required significant resources, many human resources across the organization. So we, from the Evidence to Action team, who are part of our Research Evaluation and Learning Unit, we led the process, but most of the work was done by our technical teams. So the technical teams first clearly defined the outcomes, the 5 broader outcome areas, which are the broader changes that we want to see in people's lives, and then the 26 specific outcomes. And then developed a theory of change that you've seen in the map version with the specific sub-outcomes and smaller changes for each of the 26 outcomes. This was fairly time-consuming, mobilized a lot of internal actors, and we also developed all 26 at the same time. So I think if we were to do this again as a lesson learned, we probably would have started smaller with a few and kind of tested them out and waited until we had lessons learned, and then went on to develop the whole set. But anyway, we did get there. At the same time, we had a research team working on the evidence reviews that followed fairly similar protocols to what our colleagues from Feinstein and 3IE described, and that drew on existing evidence reviews that were also already described from 3IE, the EPBI Center, Campbell collaboration, and did additional research to see if there are other relevant systematic reviews out there. We also deliberately limited ourselves to systematic reviews at this stage and as this first step, simply to make it manageable, but also to first make the most rigorous research available. And that was already a significant effort. We then developed evidence maps and models to some degree on 3IE's evidence maps. And finally, our technical teams then, once all of this was done, developed core indicators and guidance notes for each of the 26 outcomes. So all these elements then now we combined in the electronic tool, which was also a significant, I think about 8-month effort to get this all online. The tool so we recently only launched the tool. Our field teams have started using them. We're collecting great user feedback. It does make all these different elements that before were only available in old-fashioned Word and PDF and Excel files. It does make it available for practitioners. We do want to have an offline version in the future. We don't have that right now to make it available in low connectivity context. And so generally, while people are starting to use the tool, we already know that there are quite a few limitations, some related to technological issues, some related simply to time and resources. So here are a few things that we're working on, and we certainly welcome any kind of feedback if people start exploring the tool to also learn more about what works and what doesn't work and what else we need to be working on. So what we are still working on right now is that we want to expand the evidence base from systematic reviews. This is feedback received, early feedback received from our field teams, that because of the significant gaps in the evidence related to or from systematic reviews, we would like to explore whether impact evaluations, individual impact evaluations or other rigorous studies can be included. We want to add a search function of the evidence to make it more user-friendly. We want to determine what other types of information not part of systematic reviews or research, in particular cost analysis, cost efficiency, cost effectiveness analysis can be made available. And then, as Shri already mentioned, we want to increase access to the actual studies that are linked. Right now, there are some copyright issues that we need to work out. So this is the brief overview. The interactive OEF can be accessed in two different ways, either going directly to oef.rescue.org or going to the IRC on the research and evidence page. There is a link to it. We do, as we said, we are still learning and we're still improving the tool. So any feedback that practitioners or researchers have that are trying to use the tool, please send an email to oef@rescue.org. That's the email address where we're collecting all the information. And so we thank you very much for your attention, and we look very much forward to the discussion and to your questions.
Thank you so much, Christoph and Cherie, for a fantastic presentation. You can definitely see that there were many, many hours of woman and manpower that went into that tool. It looks really interesting, and we really encourage everybody online to play around with that on their own.